Hello friends, welcome to Shree Physiotherapy College Ahmedabad YouTube channel. Myself Dr. Edrish Contractor. Today I am going to discuss about Enfield. Before I start with my presentation, I would like to all the viewers to like, share and subscribe our channel to get latest update of our upcoming videos. So let's start with the presentation Enfield. So whenever we do an assessment of the movements, so we go for a step by step assessment of the range of motion. First we check the active movements, followed by the passive movements, then we check the end field, and then the resisted isometrics. Okay, in active movements we ask the patient to move the joint actively. So in this we check the quality of movement and the degree of movements, and the active movements will assess the contractile structures. But at the end of the active movements, the non-contractile structures can get stretched, and that can limit the range of motion. Okay, so the next step is we go for the passive movement assessment. So here the therapist moves the joint passively. So this will assess the non-contractile structures, especially the capsules and the ligaments. Now again, at the end of the passive movements, the contractile structures get stretched, and that can limit the range of motion. So there is always a query between a contractile and the non-contractile structures limiting the range of motion. So our another important assessment part is the end fill. So at the end of the passive movement, we give a slight overpressure, and the quality of feel is experienced by the therapist, which will help to identify whether the limitation in the range of motion is because of the contractile or the non-contractile structures. And finally we check the resisted isometric movements, in which we ask the patient to contract the muscle isometrically in the resting positions, so that will assess the contractile structures. Now in this presentation I am going to discuss more about the end field. So what is this end field? The end field is a type of sensation or feeling which the examiner experience when the joint is at the end of its available passive range of motion. The end of the each motion at each joint is limited from further movements by particular anatomical structures. The type of structure that limits a joint has a characteristic feel which may be detected by the therapist performing the passive range of motion. This feeling, which is experienced by the therapist as a resistance or barrier to further motion, is called the end field. So end field is basically divided into two types. One is normal end field and second is the abnormal end field. Normal end field is defined as the joint which is having a normal range of motion, and the motion is limited by the normal anatomical structures, whereas abnormal, as the name suggests, it is not normal, so it is known as abnormal end field. In this, the joint is having limited range of motion, and the motion is limited by the structures other than the normal anatomy of the joint. So that is why it is known as abnormal end field. So the basic difference between a normal and an abnormal end field is the movement is limited. So whenever the movement is limited, it is termed as the abnormal end field. So the normal end field is having correct end field with a correct end point of range of motion, whereas abnormal end field is, it might be a correct or incorrect end field with incorrect end point of range of motion. So this is how we can identify the normal end field and the abnormal end field. Now we'll go on to the different types of normal end fields, which is basically given by the Kaltenborn, Siriax and Paris. Kaltenborn has classified the normal end field into three types. One is soft end field, second is firm end field, and the third is the hard end field. Whereas CDX has classified the normal end field depending upon the type of structure that is limiting the range of motion. So it is classified as soft tissue approximation, tissue stretch end field, and third is the bony end field. Okay, Now let's see the soft end field or the soft tissue approximation. So the limiting structure is the soft tissue approximation. So there is there is compression of the soft tissues. Okay, so primarily the muscles. The example of the soft end field is the elbow flexion. So when you do the elbow flexion, the bicep muscle is getting squeezed. Okay, so that will limit the range of motion and the feel would be soft. Okay, and it is a normal range of motion, so it is termed as normal soft end field. Now next is normal firm end field or the stretch end field. So it is again divided into three types, that is muscular stretch, capsular stretch and the ligamentous stretch. Okay, so the feel of the stretch end field or the firm end field is like a elastic, or it is a leathery stretch, or it is like stretching a leather belt. Okay, now when we see the muscular stretch, so the limitation of the range of motion is because of the muscles, the stretching of the muscles. Example is hip flexion with knee extension. So when you go for the straight leg raise, the tension, the stretch in the hamstring muscle will limit the range of motion. As it is a normal range of motion, so it is known as the normal firm end field. Now next is the capsular stretch. So the feel is like more of the elastic stretch. Okay, and it is seen in the extension of the MCP joints of the finger, where the anterior capsule will get stretched and it will limit the extension of the finger. Okay, ligamentous stretch. Again, the feel is same as that of the like elastic stretch, and the limitation of the motion is because of the stretching of the ligaments. For example, forearm supination. In forearm supination, the interosseous membrane and the radioulnar ligament will restrict the forearm supination into further movement. So that is known as the ligamentous stretch. So all these three stretch, that is muscular stretch, capsular stretch and the ligamentous stretch, are a part of the firm end field, and this is one of the most commonest end field in the joints, as major of the movements are limited by the stretching of the capsules and ligaments. Now third is the hard end field, which is also known as the bony end field. It is basically because of the bone contacting the bone. So it is like the wooden surfaces are pushed against each other. So there is a bony block. An example of the hard end field is the elbow extension. So when you do the elbow extension, when you give a overpressure, the olecranon process and the humeral condyle will come in contact with each other, and that will block the movement. Okay, so that is a very good example of the hard end field. Now these are the some of the pictures which shows the different types of normal end field. Okay, the first is the elbow flexion, where the bicep is getting squeezed with the elbow flexion, and that is limiting the range of motion, so it is termed as normal soft end field. In the second picture, when you see the extension of the finger, the anterior capsule of the metacarpophalangeal joint will restrict the movement, so the capsule is restricting the movements, so it is termed as the firm end field. Now, and the third one is the elbow extension. Okay, so here there is a bone to bone contact, that is humerus and the olecranon process, so that will limit the elbow extension from the normal range, so that is termed as the hard end field. Now we move on to the next variety of the end field, that is known as the abnormal end field. So here it might be a correct or incorrect end field with an incorrect point of range of motion. Okay, so the range is always limited in the abnormal end field. Now according to the Carlton-Bourne, it is basically divided into four types, that is abnormal soft, abnormal firm, abnormal hard and the empty. So that is classified on the basis of the quality of feel. Okay, so first is the abnormal soft. Okay, so there is a limitation in the range of motion and the feeling is soft and boogie. Okay, and it is usually seen in synovitis and soft tissue edema. Now next is the abnormal firm. So here the range of motion is limited because of the increased muscle tone It might be because of the shortening of the capsule muscles or the ligaments. The third is the abnormal hard. So here the range of motion is limited by the hard structures like myositis ossificans or loose bodies or osteophytes within the joints. So that will lead to a hard end feel. And fourth is the empty end field. So basically it is not a real end field. The therapist is not able to reach the end of the movement because of the severe pain. The patient will not allow the end of the movement. So there is not a real end field, which suggests of some serious pathology, that is like acute inflammation, abscess, fracture or bursitis. There is another classification of the abnormal end field given by the CDX, which is based on the structures that is limiting the range of motion. Okay, so there are 6 classical abnormal end fields, that is muscle spasm, tissue stretch, capsular end fields, bone to bone end field, empty and springy. Now muscle spasm is further divided into early and late muscle spasm. Early muscle spasm is seen in the earlier part of the range, and this end field is provoked by the movement, and it is accompanied by the pain, and there is a sudden abrupt stoppage of movement. It is basically seen in protective muscle spasm after the injury. The second is the late muscle spasm. So in the late muscle spasm, it is basically seen in the end of the range, and it is seen in the instability or pain. And the very good example of the late muscle spasm is the muscle spasm which is occurring during the apprehension test of the anterior dislocation of the shoulder. Now next is the tissue stretch. It is because of the tightness of the muscles. Okay, so in the example of the hip flexion with knee extension, the tension in the hamstring muscle will limit the range of motion. So the feel would be like stretching the tire inner tube. Okay, it is not so much elastic. It is a very unique end feel of the tight muscles. Now next is capsular end field. It is divided into two types. One is hard capsular and second is the soft capsular. Hard capsular is seen in the end of the movement, and it is usually seen in the chronic conditions or full-blown capsular patterns. There is an abrupt stop at the end of the movement. The classical example of the hard capsular is the frozen shoulder. Okay, next is soft capsular. It is seen in the early range of motion, and the resistance is seen in the early range of motion, and it is continued until the end of the movement is reached. The feel of the soft capsular is almost similar to the normal tissue stretch, but there is a limited range of motion, and it is seen in the acute conditions, and the classical example of the soft capsular is acute synovitis and soft tissue edema. Now next is bone to bone end field. So it is similar to the hard end field, in which there is a restriction of the range of motion by the osteophytes or myositis or the foreign body. Now next is empty end field. So it is again similar to the one which is explained in the Carlton bone empty end field. And lastly, the sixth one is the springy end field. So this is a rebound phenomena, or it is like bouncing when you press the spring. Okay, it is usually seen in the meniscus tear, which does not allow the knee to go into full extension. It will bounce back into the knee flexion. So these are the 6 classical abnormal end field explained by the CDX. Now the significance of the end field. So end field is assessed to identify the limiting structures and to choose a focused and effective treatment. For example, if a patient is having a capsular end field, so that is the capsule is limiting the range of motion, so we need to go for the capsular stretching exercise. If the muscle is limiting the range of motion, we have to go for the muscle stretching exercise. And if the ligament is stretching or shortening and that leads to limited range of motion, then we can go with the mobilization exercise. Or if there is a hard end field like myositis ossificans, then physiotherapy is not going to work in such cases. In such cases, the loose body manipulation or maybe the condition will require a surgical intervention. So it is also used to determine the severity of the problem. So whether it is an acute condition or the chronic condition, and if the pain is the main primary restraint to the movement, then we have to go for the gentle techniques, and if the the restriction is the primary restraint to the movement, then we have to go with the vigorous treatment regimes. So it can also used to identify the severity of the problem. It is used to apply a focused and effective treatment, and it is also used to determine the prognosis of the condition. So from the type of structure that is limiting, we can come to know about the prognosis of the condition. So how to check the infield? Okay, so as we already described that it is performed passively. When you are applying the overpressure, it is very important that you have to stabilize the proximal part. Otherwise, the force or the overpressure that you are going to apply at the end of the passive movement might not be accurate, and you are not able to determine the exact end field. And next is the overpressure should be very gentle. It should not be very hard that it might injure the underlying structures, and it should not provoke the symptoms. So let's take an example of the elbow flexion infield. So in the first case, as you can see that the examiner is moving the elbow into full flexion, the range is normal, and when you give a overpressure, the feel should come soft. So if the range of motion is normal and the feel is soft, then it is considered to be a normal soft infield. Now we can see in the second picture, the range is limited. So that suggests that there is a abnormal, there is a pathology, and there is a abnormal infield is going to come. Okay, so when you give a overpressure, then you have to check the quality of feel, what you are getting it, whether it is a soft, abnormal soft, or it might be abnormal hard, or it might be abnormal firm, or it might be an empty. So if there is a pain and you are not able to apply the overpressure, so that suggests there is a empty infield. If you are getting a abnormal soft, so that suggests it might be a acute synovitis or maybe a acute edema. It might be edema. And if there is a abnormal form, so it might be because of the tightness of the capsule, or it might be muscle tightness, or it might be of the ligamentous shortening. So depending upon the end field that you get, you have to go for the treatment of that particular structure. So end field plays a very crucial role to identify the structure which is limiting the range of motion, and it is plays a very important role in selecting our physiotherapy treatment. So these are all my references. So if you really like this presentation, I would like to request all the viewers to like this presentation. You can comment in the chat box. You can share it to your friends and colleagues. You subscribe our channel so that you will get an latest updates of our upcoming videos, and thank you for watching patiently. These are our contact details. You can go through our website, email, and you can contact on the given numbers. Thank you very much. Have a nice day.